Countries in Africa are lifting lockdown restrictions put in place to combat the COVID-19 pandemic. Mauritius, considered one of Africa's most successful countries in combating the new coronavirus, just lifted some restrictions recently. Observers say the government of Mauritius responded early to the coronavirus pandemic with stringent lockdown measures and saw a drastic reduction in new cases. I spoke to Ameenah Gurib-Fakim, former President of Mauritius, about the country's approach to fighting the virus and lessons learned. Take a look.
We've had 10 deaths, actually. We've had 332 cases, most of them recovered. So for the past 28 days, that is the cycle of 2 times 14, we haven't recorded any new cases. And I think, we just adhered to what has been prescribed internationally when the first cases were detected early March. And there has been lockdown of the airspace, and the people coming in, they were quarantined. And because we have a free healthcare, so access to medicine was not an issue. And so we have adhered to the best practices all along. And people also have been quite disciplined. I must say that, initially, I must confess, it was not easy because all of a sudden your life has been completely transformed. And but, at the end, just people got to realize that we are talking about a new beast for which there was no prescribed drug as such, and people had to cooperate.
So lockdown has been lifted. Now people will go back about their business as usual. But you said something important. You said people were disciplined. So when we look to governments, when we look to leaders to take care of these issues, there is a role that communities, people, individuals must play to make sure that these measures can be implemented properly. Can you comment on that?
Yes, it works both ways. In as much as government have also, they have a responsibility of providing very clear guidelines and practical guidelines as well, because sometimes guidelines are, given, they are literally, very good academically, but when put into practice, it can be chaotic. And when these guidelines have been given in very clear and certain terms, and people have listened to it, and when people have not listened to it, I think the police has been there to actually ensure law and order and make sure that the guidelines were respected. So it was a kind of triangular kind of approach, and it was very much the carrot and the stick approach, which meant that, over the weekend, we've had lockdown lifted maybe earlier than we thought. So as of today, we can say that, we've got our freedom back.
So what would you say are the lessons learned from Mauritius for Africa and the world, really?
Well, first of all, I must say that, across Africa, the projections that had been made initially, they haven't materialized, which is a very, very good sign. Is it because Africans are getting more resistant? Because, Africa, we've had our dose of infectious diseases and pandemics, and we've had Ebola, we've had Zika, we had all sorts of these crises. Is it that? Or is it genetically there are issues there that need to be looked into? Is it the discipline that have been maintained by the government in place? Is it the discipline that have been adhered to by the public? I think it's a combination of all these together, and hopefully let us take lessons out of this that we show more preparedness, because initially, I must say my concerns when we were listening to what the WHO was saying in terms of social distancing, in terms of washing your hands, and I was very, very worried because in some parts of Africa, this is impossible. How can you do social distancing when so many people are living in one room? When water is a luxury, and where even soap and, running water cannot be found. But, just again, keep fingers crossed that this will be okay for the rest of the continent. And very soon the COVID will be a very bad memory.
Let's talk about something else that you're very passionate about, which is digging into Africa's herbs to find potential cures and medicine. Talk to us about this passion of yours and why it is important to look into African traditional herbs, especially with an experience that we are all witnessing when we look at what's happening with Madagascar and Covid Organics resorting to Artemisia. What role African herbs can play in the big picture of medicine, or in particular with COVID-19?
You know, up until 1945, the Second World War, the entire world, we were being treated with herbs. Why I mentioned the milestone of 1945, this is when we got the antibiotics. We started with penicillin, and since then we have gone all the way into synthetic medications. So what happened is that as the years went by, we have started marginalizing the herbal medicine because we have focused mainly on synthetic antibiotic and all the rest of it. Now, at the end of the day, the scientists proposing these new cures as modern medicine, they still have to go back to nature to look for that single molecule. Now, if you look at the contribution of the entire world, the developing world to the world of medicine, we find that they have made phenomenal contribution. But Africa is still lagging behind. And I put this down to two main reasons. First reason is that we haven't really documented our own traditional knowledge, because the documentation, or rather the transmission in Africa, has been oral. And every time an elderly passes on, we have lost a library. Now, to come back again to the artemisinin, in 2003, when they had SARS, it has been reported in the literature that to treat SARS, extracts of artemisinin had been used for the treatment of SARS, and SARS is a corona. So now we have another coronavirus. So I could extrapolate from there that there may be something in this Artemisia annua, which gives artemisinin, which grows in Madagascar, that is providing solutions. But of course, we don't know because the tests are ongoing for COVID, for the Tamba of CVO, as the president calls it. But it is critical that we safeguard not just the biodiversity, the plants, but also the traditional knowledge that goes with it. And this has been part of my work as a researcher, is to document precisely these traditional knowledge, and I have published the database, which is now in the public domain.
It begs the question, do herbal and traditional medicine undergo the same rigorous process as conventional medicine?
When we develop a medicine, modern medicine for a plant, usually we take the plant, we take the extract, we isolate the one molecule. And this is the silver bullet, which actually goes into the formulation of the drug. But increasingly, for herbal medicine, we adopt what is known as reverse mycology, that we observe what is happening on the ground, and then we take the recipe and we test it in the lab. And this is what is the procedure which is accepted and acceptable for herbal medicine, because as I said, they have been used. I think this is the approach that the Chinese are doing, and they're doing it so well, because China has given the same status as allopathic medicine to Chinese herbal medicine. Now, why it's important again to add value to this traditional knowledge? Because A, they give new molecule for medicine, and B, they are an accepted and acceptable form, which we have taken for so many years by our grandmothers have been giving us these recipes, and it is socially and is culturally accepted to be treated by herbal medicine. So I think the procedure are different.
What will it take for African traditional medicine to get recognition and respect, if you will, that Chinese medicine receive at the international level?
We start with ourselves. We start recognizing, we start accepting our own heritage. We start accepting our own traditions. We start accepting our own medicine as has been given to us by our grandmothers and which work. And in fact, if you look at even WHO figures, they will tell you that 80% of the world's population still depend on herbal medicine for their primary health care. Now, if you look at it from the economic point of view, it's a huge business which can emerge out of this, because not only is it cheap, it's accessible, it's affordable, and I will add further, it works.